Thank you for being here today. I have a 1 o'clock obligation, and so if we can finish our meeting by 12:45, I would be grateful. That's a really not very subtle hint. Item number 2 on the agenda is the approval of the agenda. Chair will entertain a motion. Thank you. Any questions on the agenda? All those in favor will please say aye. Aye. Any opposed? Thank you. And now to item 3, public comment. Is there public comment? Seeing only department heads here, we will close public comment. Item 4, committee items. First item is approval of the minutes of last month's meeting. The chair will entertain a motion. Thank you. I have motion and support. Any questions on the minutes? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. And now to appointments. We have openings on the Department on Aging Advisory Council. We have a public member seat whose term expires on December of 2026. Current member is Ashley Taluki. The applicant is Mary Baird. Chair will entertain a motion. Mary Baird has been nominated. Are there any other nominations? Hearing none, all those in favor of Mary Baird will please say aye. Aye. Any opposed? Thank you. There are 3 remaining vacancies. Suggest to committee members, if they know of anyone who would be interested, to please let them know. We'd be glad to have them. I saw Mary Baird's application. She looks like a very qualified person, and we look forward to having her on your advisory council, Madam Director. Sorry, just maneuvering through the agenda here. And now the medical care facility. Sorry, it took me a moment there, Madam Director.
I like the new fresh look there. Of the software.
Oh, okay. I'm quite sure my look would never be described as a new and fresh look, no.
Can you turn on your microphone?
Turn the microphone on, please.
Oh, yeah, that would be helpful.
Yep, thank you.
Okay, there we go.
Sorry, Ray.
Okay. So we did not have financials for this month as our board meeting was a little earlier than usual, but I did want to share with you our annual budget that was approved on 12/17. We budgeted for a census of 183, which is a few bed days less than what we've budgeted over the past few years. We've struggled with that census number, so we went with a little bit more conservative estimation there. For operating income before interest and depreciation, we're looking at a net positive of 1.2 million. After depreciation and interest, we're looking at a net change of assets of 907,064. Now, we are going to be cash flow negative for the year, but this is related to the cost report settlement, which we've talked about each month when I've come, that's still payable. So we've included that in this year's budget as far as our cash flow estimation. So we estimate negative cash flow of $233,049, which we currently have in reserves. So I just wanted to share those with you. I know there's been a lot of questions about what a new budget and a balanced budget would look like. So I just wanted to share with you what we have for 2026. And then on our next slide, I just wanted to share with you where the census trend line went for 2025. So we did dip off near the end of the year, so we're working on census recovery here in the month of January, but should be able to recover that here within this month and be back at our previous estimations for the 2026 budget. And that is all I have to report. Any questions?
Questions for the medical care facility? We hope it goes through. The cost settlement, that was related to it was a error of a couple of years ago, wasn't it?
That's
And it's just-
correct.
We have not yet settled up with that.
Yep, so we're waiting for the invoice on that, and we don't expect that invoice until probably September of '26.
Okay. All right. I wish people would wait that long to bill me for things I owe. But there we go. All right. Chair will entertain a motion to receive the report. Thank you. There's motion of support. All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you very
Madam
much.
Director. And approaching the podium now is the Department on Aging. Welcome.
Good afternoon, everybody, and Happy New Year. Just a few things to highlight for this month in January. We are blessed to have received the donation from the Fraternal Order of the Eagles again. This is something they've been doing over the last several years, so we received $1,000. This is definitely something that we use on our enrichment side, really focused on the activities that happen at the center and if there's needs that come up within those programs. I know recently before the holidays, one of our drumming classes was exploding with people, so we always have to look at increasing as those classes continue to grow, increasing supplies. So, purchasing the balls and things like that, that really makes it easier for the older adults as they come in to have all those supplies ready for them as they come into the classes. So, the other things we might use it for are different craft programs. We do a lot of craft and chat programs. A lot of people enjoy that activity. So if we can help, again, purchase those supplies so that people can participate, that's always beneficial. We're working with Community Action Agency on the VITA program, which is the Volunteer Income Tax Program. We learned there's been a few staffing changes, but we are still able to be a host site again this year. It's definitely a time for us where we can promote all the different activities that we have to offer as we have older adults come in for those tax appointments. Sometimes it's their first time coming into the Department on Aging, and they get to learn about all the different things that we have to offer. Definitely encouraging them to join us for other activities and have lunch. Definitely it's a way for us to support that Community Action Agency and getting that program up and going. And there's not a lot of staffing time for us for that. We are also working with Michigan Secretary of State doing a mobile clinic. These have been very well received at the Crouch Senior Center. At the last one that we had 35 people attend. And again, these are people that might just be getting their driver's license updated, maybe having to do something with a vehicle registration. And sometimes they just come in and they have questions, and the staff is able to help assist them. And it's they don't really have to wait very long. Sometimes they don't have to get on a computer to book an appointment. They just know they're going to be here, and they're able to walk in and get some of their needs met. So if it's something that they're unable to process on that day, they're encouraging them and will help them schedule a future appointment. With the holiday meal that we did here in December, I kind of added a couple pictures for you all to review. I think that it definitely, when you look at that meal, it looks amazing. Our kitchen team did a fabulous job getting that meal together. I know last time I showed the Thanksgiving meal, but I think our December meal even looked better. There was 107 people that came in to dine at the Crouch Center. It's really helpful to have that multi-purpose room off from the main dining. So we added extra tables, and I had entertainment and things like that going on. So it was a lot of people in to enjoy a fabulous meal. It was amazing the number of calls that we received from our home delivered meal clients that were just really felt blessed with the holidays and receiving that meal. We were able to share some of those calls with our kitchen team so that they could actually hear the senior expressing their appreciation. So it definitely was uplifting and kind of a warming day that day before the holiday to be able to put out such a great, fabulous meal. And we just have a couple upcoming presentations, working with WellWise. There's actually one today focused on protecting yourself from scams. And then we have another one where we're doing more of like a self-defense kind of teaching class. This is with a volunteer from the Y. And that will be on February 11th. And then we're working with Henry Ford, coming off the holidays, people may be experiencing different kinds of grief and loss and things like that, and having a speaker come in and just kind of talk about how to work through some of those things and supports that are available in our community. So that's really all I have for this month. Things are just running smooth, and we're pretty excited for 2026.
Questions for the Department on Aging? Thank you for the work, Danielle. The chair will entertain a motion to receive the report. Thank you. I have a motion of support. Any questions? All those in favor will please say aye. Aye. Any opposed? Thank you.
All right, thank you.
Thank you, Danielle. And now the Health Department. Madam Health Officer is here. I think that's next, must be next year coming up.
Yes, it's
Update
me.
the food service license fee schedule. Okay, yeah, thank you.
I have two items. One is a item request to go to the full board to change our food fixed establishment fees to align with the state risk category. Since the early 2000s, and I was definitely not here and part of that conversation at that point in time, but since the early 2000s, we have followed kind of a hybrid model of with an A, B, and C schedule and then within that, we've had a type 1 and 2. During the transition to our new software, which was approved last year, and as we get ready to implement and go through licensing renewal upcoming that starts we send license renewals out in March, and the state license year begins in April. We decided that our best bet would be to align with the state. We've wanted to do it for some time. Going into the new Hedgerow software that we'll have, it makes sense to go at this time. What that does is most of our fees, actually, you'll see on the attachment that's up in front of you, will go down, especially for a great majority of our year-round fees. And then we are proposing to change our nonprofit to just do an overall 25% discount for nonprofit, and then seasonal will be discounted accordingly as well. Some of the rationale is listed in the staff report, but I'm happy to explain more if you have any questions on the whys or reasoning behind things.
So I guess I would ask, let's see, on the nonprofit annual type Z, we have 6 licensees, and we're increasing as to each one $232.50. Give us an example of what type of a organization that would be.
So the 6, I could just give you the 6 that we have, though it is Henry Ford, Jackson Country Club, the Jackson City Center, the Crouch Senior Center, Tone Pace, and Cascades Manor House are the 6 that are
So
that
those are,
substantial
and so there's a description of each type, which we haven't really had to worry about too much before because the fee was all the same for each one,
The
right?
fee was all of the same. It was not based on a risk base. So we could have an ice cream shop that was open, or I don't know a good X. I don't know if we have any X's. There's one X on there. So I unfortunately don't know what the X nonprofit is. But we were not basing that. So really this attributes and goes back to the amount of work that's required for an X, which is like a coffee or a place that doesn't have a complex risk categorization, and then those Z's are full course, could also distribute food to vulnerable populations. So that's where you'll see some of that with like the Tone Pace and the senior center and some of those.
Okay. Questions for the department? Go ahead, Commissioner Willis, please.
Thank you, Mr. Chair. So the type Y,
Type Y is a lot of the regular, like the prepare and serve. So it's frozen, prepare and serve, where they're not one of the things that I think about is if you think about like one of the Mexican restaurants or the places that's preparing fresh salsa and things like that. That's a Z compared to something that's coming out of a jar or out of the freezer, or, there's kind of those heat and serve type places are the Ys. And Z is everything where they prepare, the from-scratch menus.
So this is
Or
a
more from
recommendation then
scratch.
to the full board to adopt this fee schedule.
Yes.
Chair will entertain a motion to recommend this fee schedule to the full board for adoption. Thank you, Commissioner Bear and Commissioner Williams. Any further questions on this? All those in favor will please say aye. Aye. Any opposed? Thank you. And now on to your report.
Thank you. My report is pretty standard this month, kind of par for the course around places. You go through the holiday season and things slow down a little bit. Of course, our school programming and some of the things just, our building slows down a bit. Couple of things to note on the first page here. I've asked for, we're just trying to show a little bit of the impact and things that our programs are making. And one of the little excerpt that I sent out was from one of the surveys that our Children's Special Health Care and MIHP recipients receive. And, I just think the last line there, I think more people just need to know that this is a resource. And above that individual is talking about, parenting resources. And, parenting is hard, and having support and some of that available is important. It's one of the reasons I try to make sure we highlight everything we do in our different programmings, and make sure that our community knows, so you all know, and so that our community knows, what is available through the health department. To address, I think Commissioner Williams last month asked about I don't remember if it was TOP or EYT, but we didn't have a Jackson Public School in there. And I actually got back to the office and was told right away that we actually started there the following week. I think they run on a semester or trimester calendar, and so we actually started in. We've been in Parkside, but then we were also in Jackson High as well for the TOP program. So I just wanted to make note of that. On the second page, a couple interesting things. I know I've brought to you before, and I might have even shared a link to Spotify advertising that we're doing as we are trying to reach the community. One very, very cost-effective way we found to be able to do a little bit of marketing. Very few of our grants have marketing, but marketing funds attributed to them, but we are supposed to market and reach, our community. One way we found to do that is through Spotify ads. I don't remember the one that I specifically told you about a few months ago, but for the cost of the total cost of our Spotify ads reaching 52,791 individuals, and the number in 2025 was very likely under $500 for that reach. Across various programs. We've talked about immunizations. This month we have one started for radon. I was just talking to Commissioner Shotwell ahead of time. It's National Radon Month. And so we have one going, and that works on our demographic. Those are individual reaches in our community. It's based on where someone, the GPS location of where someone is listening to that. So, it's quite a big reach. And I just, share that for a very, very low cost per individual. We have a new health educator starting in that position, and then we start our new opioid RFP funds distribution for the community starts this month. So you'll see more information and updates on that as we move along. Personal Health and Prevention Services, our WIC program, we've trialed. I talked last month a couple different times about our walk-in dates, and we took a poster presentation to our Michigan Public Health Premier about our walk-in dates and how that's worked. We're still continuing to work on those, and we are open every Thursday now through 2026 for walk-ins for our WIC clients. Respiratory virus season, it is that time of year, so you'll see that the numbers have jumped up in the middle of December, and they will probably stay a little bit up now until the weather, changes and we start moving outdoors a little bit more. The rest of our immunization reports are in there. And then just lastly, I want to talk just for a second about environmental health. It is our slower period, so if you happen to talk to any of I would say it's our slower period for our field programs, but don't worry, we keep them busy at this time of the year. We are going through, and they are constantly being bombarded by us by policies and procedures at this point in time, and making sure that the work we do is documented and we align with that, and we get everything ready so that when campgrounds and pools and all of that starts, and people start drilling for wells and those things in the spring, that we're ready, and the staff are ready and trained for all of those activities. That concludes, if you have any
Okay,
questions.
Questions for the Health Department? Hearing none, Chair will entertain a motion to adopt receive the report.
Mr. Chair, I'm sorry, before we
Go ahead, Commissioner Williams.
conclude with the voting, I do have one or two questions. I do apologize. Just very quickly, first and foremost, thank you for getting back with me on my request there. And then secondly, I was wondering if you have a job description for the health educator position?
Yes, we actually have one posted on the county website right now. Our teen pregnancy prevention one is actually open right now. Our coordinator is filling in for that. So that one, our health educator positions are very universal, the actual job duties. We do put a focus on the type of work that grant is, that is funding that position. So like this one will say health educator, teen pregnancy prevention initiative, but the duties aligned are all the same. But I can email it to you as well.
That'd be great. Thank you. Nothing further, Mr. Chair.
Thank you. I think, did we have a motion and support to receive? Yep. Anything further to the Health Department? All those in favor of receiving the report will please say aye. Aye. Any opposed? Thank you.
Thank you.
Got it back up here. We now move on to other business and the claims. Chair will entertain a motion to pay the claims. I have motion and support. Any questions on the claims? I have them right here, Tony, and we'll bring them down to you in a minute. All those in favor will please say aye. Aye. Any opposed? Thank you. Now on to other minutes. Please take note, members of the DHHS Board special meeting and regular meeting. I think the special meeting was for the adoption of the budget, was it not? Of the DHHS budget? Yeah. All right. And then public comment. We're now open to public comment. Any public comment? Last call for public comment. Public comment is now closed. And now committee member comments. Any committee member comments? Hearing none, thank you. Last chance for comment. We stand adjourned to the call of the chair. Thank you.